Fusion. We'll get going because it's 2 o'clock now. Um, so yes, over the next half hour or so, I'll be going through the slides and then we'll go on to the system. Although I've put quite a lot of the support information onto the actual slide itself when it comes to care planning. You'll get the recording as usual, and the link to the CPD certificate, and the resource pack as well next week. So keep your eye out on the email that you use to register for this. That's where you'll get it. Keep your eye out and you'll be able to get the CPD certificate. Obviously, you need to have stayed for the whole session. We do keep a log of that. So make sure you stay for the whole session, and then we'll get that sent out automatically to the ones that were able to stay for the whole thing. So let's get going. We're looking at confusion. I'm actually just going to turn my camera off for now, but keep the sound on. Hopefully you can still hear me. Hopefully you can still see my screen. So we're looking at confusion, as we say. I would ask if you can just pop things in the chat rather than unmute yourselves, because it can get a bit chaotic sometimes and lose our thread. But if you can pop things in the chat every so often, I'll have a quick look and I'll just see if there's any questions as we go. But also we can have questions at the end by all means. And if any of you wanted to go through anything extra with me or something that you think about afterwards, you can always message me at lucy@carebeans.co.uk. That's me, of course. Lucy, I'm the nurse at Carebeans. It's lucy@carebeans.co.uk. You can always message me independently of this, and I'm more than happy to answer your questions or go over anything that you need to go through. So let's get going then. So we're looking at confusion, supporting service users with confusion. So we're looking at community settings, we're looking at residential settings, and all the different services that we sort of cover. So Maria is saying, oh, my colleague registered over, she didn't receive the link for the training. Ah, right, okay. I'll just quickly see if I can get a message sent over to see if that, I can't really sort that out myself, I'm afraid, on here. But while we've just started, would you mind, actually, if you're listening, would you be able to message laura@carebeans.co.uk? I'm just going to message you now, say, await an email. And then just message, if you message laura@carebeans.co.uk and then just message your friend or your colleague's email address and she can get that out to her as well. Okay, so we're looking at confusion. Sorry, let's put a spelling error in there. There we go, from customer. Okay. So we're looking at confusion and what that means. So let's carry on. So the webinar today is going to cover what is confusion? What do we mean when we talk about confusion? We're going to be looking at sudden confusion, so sudden onsets of confusion, and the causes of those. And also we're going to look at long-term confusion, the causes of that, and we're going to look at care plans sort of really around long-term sort of confusion, with conditions that we're aware of, like dementia, etc. And then we're just going to look at how to document and evidence that you're supporting someone with confusion, along with some suggested support that we can put in care plans, which, as I say, you will get these slides, so you'll get to see all of that. Okay, so let's carry on. Brilliant. Thanks, Maria. Yeah, sorry about that. It's a bit of a pain, but thank you for doing that. She's awaiting the email. I've just messaged her, so she'll send that straight out. Okay, so that's what we're going to cover over the next half hour or so. So when we're looking at confusion, for some service users, confusion is normal. For some people all of the time, or for some of the time. For others, confusion isn't normal. We just need to be aware of both of those scenarios. So sometimes if an older person is poorly, well, especially an older person is poorly with something else, confusion, like an infection, for example, or illness of some sort, confusion can either get worse or it can suddenly appear as a result of some other medical issue. So if we go on to the next slide, which is what is confusion? So what confusion is if someone cannot think clearly or speak clearly or very quickly, if their speech might be slower, might be struggling to sort of find the words. That's how confusion sort of presents itself. The person might also be disorientated, so they are having troubles with orientation, they don't know where they are, for example, or who you are, what time of day it is, etc. They might struggle to pay attention if they're confused or remember things if they're confused. And someone with confusion might also suffer from hallucinations. So when I say hallucinations, I mean seeing or hearing things that aren't there. And as I say, for some service users, that's normal to be confused, or some of the time maybe, or all of the time. And for others, it's not normal to sort of be displaying these symptoms. It's not expected. So if it's sudden confusion, that's what we're sort of going to concentrate on now. Just have a quick look at that message down there. Oh, that's all right, Nicola. Don't worry. Nice to see you here. And you'll get the slides anyway, so that's fine. Don't worry. Nice to see you. So sudden confusion, sorry, I've got a tickly throat today. Sudden confusion or delirium, someone who's become delirious, can have lots of different causes. Whatever that cause is, you just need to get help immediately for that person. Whatever is causing their confusion, get help immediately for them. And certainly tell a senior within your service who can then go on to get help, medical help, 999 or doctor or whomever. So if someone has suddenly become confused, that's what you need to do. You need to get medical help immediately, and you need to tell someone, tell a senior. If you do suspect that someone is confused, then one of the things you could perhaps do is try asking them their name, their age, and today's date, for example, to see if they can answer those questions. If they can't, that could suggest that they're confused. Also think time, place, person. So in other words, you could ask them what the time is, or the day, or the date, what time of year it is, for example. You could ask them about the place where they are, and you could ask them about the person who I am, for example, who am I, and see if they can answer those questions. If they should know you, that's obviously if they know you, then you can ask, who is it that I am, or anyone else that they might know. So if they do seem unsure about those answers, or they can't answer you at all, they probably do need medical help if that's a sudden thing. So, get advice on that. You could also, if it's not urgent, and if it's someone that's perhaps getting increasingly forgetful or confused, they might have dementia, they might be, or whatever it might be, but they might be getting increasingly forgetful over time, then it's best to see a GP if you're worried about that, if they're becoming increasingly forgetful or confused. So it might not be anything serious, but it is just best to get it checked out, because obviously, new onset confusion or sort of ongoing confusion over time might be a sign of dementia or something else with that person. So you just need to get advice on that. So just to reiterate, urgent advice is required if it's someone that's suddenly becoming confused, or if it's worse than normal. So if it's suddenly become worse than normal, that confusion, call 999 or medical professionals if it is sudden. So, because they need to be treated really as soon as possible, assessed as soon as possible, because sometimes it could be life-threatening, something that's causing confusion. So it is urgent action that's required. And whether you've contacted the GP or 99 or whoever it is, just make a note of any other changes. Just be thinking of any other changes that you might have seen, as well as this sort of sudden confusion, so that you can provide as much information as possible to that medical person about what's happened and about how they appear. So things you might want to think about with that, just information that you might be able to gather if you're able whilst you're waiting for medical help for that person. Is any other changes in recent eating and drinking habits, for example, whether they've got a temperature, if you're able to measure that. So that could suggest an infection, whether they've got a cough or a cold or a newly developed cough or cold, whether they're constipated or not, whether they've got any pain, or whether they've got some bladder infections or anything along those lines. So they're just things that you could, mark down when you're waiting for medical help, just to help the medical team. You wait for an ambulance or whatever it might be. So if you are waiting for an ambulance, for example, or medical help, and that person has suddenly become confused, there's a few things that you could sort of suggest, like do and don'ts, really. So if you are waiting for an ambulance with that person who's confused, do stay with that person. So don't leave them unattended in case their health deteriorates suddenly. So just stay with them, because they could be frightened as well. Use simple words, short sentences. So keep communication nice and clear so they can understand what you're saying to them. Because if they're having trouble understanding things that are being said, it's, you know, it's best possible to keep that short, clear and concise. Um, and it's also a good idea to know any medications that they're taking as well. We'll come to medications and why that's relevant in a sec. But just note what medications they might be on. They're the do's, and then the don'ts are don't ask that person lots of questions. Don't sort of overwhelm that person who might be feeling confused. Don't sort of bombard them with questions or chit chat. You know, just keep nice and calm and quiet while you wait for the ambulance. And also don't stop them moving around. So by that I mean if someone is sort of confused and agitated and wants to kind of wander around, doesn't want to sit in one place, which could happen. As long as it's safe to do so, of course, then you know just let them move around the room that they're in. Um, you know, obviously as long as they're safe and there's no obstacles that they might harm themselves in, or if they're in danger or whatever, you know, then you wouldn't sort of let them do that. But you know, rather than trying to sort of restrain that person and keep them sitting still if they're not wanting to. So we'll just move on now to causes of sudden confusion. This can be similar to causes for long-term confusion as well, but we're just focusing for this moment on sudden confusion. So it can be caused by different things. Best not to try and diagnose it yourself. Best to get medical help, as we say, if it becomes suddenly confused or delirious. But some of the most common causes of sudden confusion can be infections, any type of infections. So if that person is experiencing an infection, that could cause confusion. And particularly, as I'm sure we're all aware, and I'm sure we've all witnessed and experienced before or seen with our service users potentially, UTIs. So urinary tract infections, so water infections, bladder infections. So UTIs, they are common. That, you know, we try our best to support the people that we're supporting to avoid those where possible. But they are quite common still in a lot of elderly people, especially people with dementia, for example. And they can cause quite acute confusion quite suddenly. It can be quite alarming how quickly that can happen. So it's best to get that person checked out ASAP so that they can get treatment for that infection, whatever's causing it. They can have the appropriate assessments, etc., scans and all that type of thing, blood tests. Strokes or TIA can cause, obviously that causes a lack of oxygen in the blood. So that's what's called hypoxia, causes lack of oxygen in the blood going to certain parts of the brain. So that would be caused by an occlusion of some sort of clot of some sort. That can cause sudden confusion, as can a TIA, which is a transient ischemic attack. That's a TIA. It's basically a mini stroke, they're called, and it sort of happens as a clot kind of passes through slowly, stopping oxygen to that part of the brain, and then it continues to sort of pass through, and then they're okay. But sudden confusion could be, you know, could mean that either of those have happened. Someone with a low blood sugar as well. So someone with diabetes perhaps, and they're suffering a low blood sugar, or what we might know as hypoglycemia. So not hypo. So low blood sugar. That can cause sudden confusion as well. So it's important to sort of know what measures we need to take if someone has got a low blood sugar, like giving them something sweet or a carbohydrate or something. And obviously contacting get someone for help, contacting medical services. A head injury, of course, that could cause confusion, depending on what part of the head it has injured or what part of the brain might be injured. And then some medicines. So we just quickly touched on medicines before, something that you can jot down as you're waiting for the ambulance. So some medicines might cause toxicity to that person. So it might be toxic. So things like, for example, digoxin. That is a drug. It's quite a common drug, and it's given for arrhythmias and abnormal heart rhythms. And if that's not cleared properly by the kidneys, for example, if it's some kind of kidney injury or dehydration or whatever, but if it's not cleared properly by the kidneys, that can cause toxicity basically, which can cause a kind of delirium and confusion. So that's really important to get medical help for that reason. Some people might have stopped medications recently. So there could be sort of withdrawal symptoms that could be causing confusion as well. So just be mindful not only of what medications they're on, but also what they might have recently stopped. Because because that could be causes of a withdrawal type symptom. As well as can alcohol poisoning or withdrawal from alcohol as well. That can often cause confusion too, as can taking drugs. So people can hallucinate or become confused if they're taking certain drugs. Carbon monoxide poisoning also is another thing to consider. So it's a sort of silent thing. You can't sort of smell carbon monoxide, so it's best you do need to have kind of carbon monoxide monitors within the home. So if any other service users or staff are becoming unwell, it's something to be mindful of that as well. It could be sort of carbon monoxide poisoning if you haven't got monitors in place. But that can cause confusion, as can problems with heart and lungs. So maybe someone that experiences asthma attacks, for example, so lack of oxygen, or shortness of breath and things like that can cause lack of oxygen, therefore confusion, as can seizures, so caused by people with epilepsy. And then finally, on certain causes of confusion, the sort of major thing to always consider is sepsis. I should have put that in red, really. But sepsis, and especially if it's accompanied by the signs of deteriorating health, like low blood pressure, heart rate increase, respiration rate increase, etc. So sepsis is the body's reaction to an infection, kind of goes into overdrive, can become very dangerous for that person, could be fatal. So it's very important to get that identified and treated early. We do have the news chart now on the system, which I'm going to show you a bit later, and that's like the National Early Warning Score, which it looks at confusion, new confusion as well. Don't know if you've heard of that or you haven't heard of that, but I can show you it. I am planning to do in the new year a webinar on news charts recording. So, but that identifies, it gives a score and it identifies whether that person could be at risk of sepsis. So I'm going to show you that briefly at the end. But if you do want a further lesson on that, then please do drop me a line, lucy@carebeans.co.uk. It's on everyone's system. It's an observation that can be switched on, like home care or care homes, whatever service it is that you've got. You can switch that observation on. You obviously need to be able to take those different vital signs, blood pressure, etc. I'll show you what you need to take at the end, and you need to obviously your staff need to know how to take those observations, identify whether someone could potentially have sepsis or at least deteriorating health, if not sepsis. So now that's sudden confusion. We're going to sort of look at long-term confusion now. So long-term confusion, some medical conditions can cause long-term confusion. So this is confusion that is a kind of a long-term thing. It's something that we are aware that that service user has or experiences through for whatever reason it might be. And that's what we need to sort of think about when we're doing our sort of long-term care planning for that person, the kind of support that they might need. So a stroke, because before that can cause sort of long-term confusion depending on what part of the brain has been damaged. Epilepsy and seizures can cause sort of damage to parts of the brain, as we said earlier. Poor kidney function. So if the kidney is functioning poorly, that can mean toxins are accumulating, which can accumulate in the brain. Things aren't kind of working properly, filtering properly. That can cause sort of long-term confusion if someone's got poor kidney function. Someone with psychosis, so that experiences psychoses or psychosis on an individual basis, but psychoses on a sort of as a plural. That's someone who experiences like mental illness, and they might experience psychosis, and that's where thought and emotions are so impaired that contact is lost with external reality. That's what a psychosis is. Affective disorders. So there's certain illnesses that affect the way you think and feel, like for example, mood disorders. So major depression, for example, that can make people feel confused at times. And then Alzheimer's disease or other forms of dementia that can cause long-term confusion too. And as we know, with those conditions like dementia, for example, it's not continual confusion. It might be that people are lucid at times, periods of lucidity, where they can think clearly and they're not confused, they're less confused, or they've got clearer thinking. It can be sort of better than other times where they might be more confused. For example, nighttime, for example, they might be more confused. So it does fluctuate, confusion. So if we just look now at care planning. So when we're care planning for someone with long-term confusion, we need to be writing all our care plans around the fact that that person may suffer sometimes from confusion or may experience confusion sometimes. So on the sort of care home supported living environment, of course, you've got many different care plans. On the home care environment, you've got the home care plan. So in the home care plan, you've got different domains. In the care home side of things, you've got all your different care plans. So all the care plans and all the domains should be written in a way that's thinking about how we can support them with their confusion, to be as orientated as possible, as independent as possible. You can even create bespoke care plans if you wanted to on the system. So a dementia care plan if you wanted to, but really think about the fact that all of your care plans should be written in a way that is taking into account that person's confusion and how we can support them with that. So, for example, if we did an eating and drinking care plan, we might detail how we're going to support them by prompting them to eat and drink, for example, for helping them to make food choices on a day-to-day basis about what they want to eat and drink, assisting them to the dining room if they forget where that is, for example. If we did a communication care plan, that might detail how best to communicate with that person. So, like we said before, short, simple sentences, pictures, for example. Perhaps recording when they are more lucid, so they can sort of discuss their care and treatment more when they are more lucid. So, in other words, all care plans should be written in a way that's mindful of that person's confusion. So, we have I've obviously got 3 areas in the care plan which we've looked at before: the needs, the goal, and the support. So what's causing their confusion, for example, in the needs, and then the goals, how we want to be as independent as possible or whatever. We can't cure confusion, but we can help them to live well with whatever it is they might be experiencing, like dementia, for example. And then support. So support needs to look at lots of different aspects, of physical aspects, psychological support, communication. We're going to break these down a bit in a minute. Social activities and medications. So we need to be sort of mindful of all of those different things when we're looking at support. And I'm going to break that down now. So rather than look at the care plan on the system, I'm just going to look at the support section on these slides. And then I can send these over to you. You'll get all of these as well. As I said before, just see if there's any queries. No. Okay, so let's just go through a few examples of the types of support we can give that person, and we can document in our care plans to show how we're going to support them. So reassurance and explaining things to them. So offering that person reassurance, how we're going to do that, how we need to sort of, explain what we're doing, for example, using a, nice gentle approach for that person. So just explaining any support or activity with the service user, using clear language, short, simple sentences, as we said before, to sort of aid understanding. We might want to think about face-to-face communication and record how that's important in the support. So no outside distractions. We might want to explain how we'll give that person time to understand us when we're talking to them. So speaking nice and slowly and clearly. Another thing we can consider in our support is regular repeated clues that we might give around the environment that they're in. So regular and repeated visible and verbal clues, like, for example, as to the time of day, the time of year, today's date, for example, to keep them orientated as best as possible. So a clock with a date on it, a season maybe, the year. As well as the time of day, so that it's just much easier for that person to stay orientated as much as possible. I know some clocks do have the visuals on them, don't they? Like a sun for the daytime and a moon for the nighttime, for example. So it's just visible clues that we can give to that person, and it's important to record those in the care plans so that we can, evidence that we are assisting them in many different ways. Time shifting as well is a term that's used when a person experiences or feels that they're living at an earlier time in their life. Like some people with dementia, for example, might feel that they're living in a much earlier time than they are, so they might become disorientated. and confused quite easily. So it's just important to sort of put those as many regular and repeated visible and verbal clues as we can. Consistency. So that means it's what I mean by that is consistency in their daily routine. So we can evidence how we're going to help them with that. So a daily routine, for example, that's calm, that's at a set pace. That's always better for a service user if they do experience confusion. And the elimination of noise as well. So obviously not all noise, but unexpected and irritating noises, for example, alarms, background noise, loud television, that type of thing. So again, it's all about not overwhelming that person with, you know, too much noise and stuff going on really to sort of help with their confusion. So good lighting levels should be maintained in all rooms, appropriate to the time of day to aid someone's confusion. Avoid mirrors and reflections. That doesn't mean you need to take all mirrors down necessarily if they like to use a mirror, but it's just being mindful of the fact that reflections can make people confused. I mean, some people, for example, like I was saying, that time shifting, if they think it's before now, they think that, you know, it's when they are living when they were younger. If they then see themselves in the mirror, that might be quite confusing for them because they're not expecting to see who's looking back at them in the mirror, you know. So it's just being mindful of those sorts of things, and also reflections, like for example on the floor, water on the floor or shiny surfaces or something that might cause reflections that distort images. That can be quite confusing for people as well. Hearing and eyesight. So any problems with hearing and eyesight can increase confusion. So it's just important to make sure that anyone that does have glasses or eyesight support or does have a hearing aid or hearing support, you know, to make sure that they're on hand, you know, got batteries nice and clean and all that type of thing, and just to make sure that we've got that documented, that we're going to do that for that person, and make sure we've got them at all times switched on, clean and all that type of thing. Nutrition support as well. So eating too little or missing out on essential nutrients, that can cause you to become resistant to illness and can make someone with dementia feel more confused if they've become poorly or not well nourished. So that's just an important thing that you can perhaps put in your eating and drinking care plan, for example. And then we've said this before actually, but a nice gentle approach to that person. So just treating them, you know, calmly, avoiding any sort of physical restraints or anything for that person that might be confused. Treat them with a nice, gentle approach as much as possible. Sleep patterns are also important as well, in someone that might be, well, in everyone really, but in someone that might be experiencing confusion. So it's really important to try and maintain or at least restore normal sleep patterns where possible. So what support you're going to give them to maintain a good sleep pattern. Help with using the toilet, for example. That might be a frequent support need that people have. And so it's just making sure that we've got our support recorded as to how we're going to do that and support them where needed. And then visits from familiar people. So friends, family, helping people to keep in contact with those people because they might help them to remain calm and agitated and less confused. And then finally, I've put in here explaining the nature of confusion, because it's always a good thing to explain to that service user why they might be feeling confused. So it could be that you feel that they won't understand if you're telling them why they're confused, but it's best not to assume that really, because they might do. So, you know, it's a really good idea to explain to that person why they might be confused. It might be that they've got dementia, it might be that they've got an infection, it might be that they've had a stroke, for whatever reason it is, and they're experiencing this confusion, short term or long term. You know, explain to them if you know why. That is what the reason is that they're having that, because it might, as I say, it might feel like they won't understand, but don't assume that. And then these things, of course, need to be reviewed and updated accordingly, just to make sure that the support is going to plan, it's all working, that person is, you know, living well and independently as possible. Okay, so before we go on to the site, just have a look at a couple of things, because we've really looked at the care plans there on those slides. But really, it's a question of monitoring that confusion. So you could put actions in place to monitor their well-being, for example. But it's sort of monitoring that confusion to see if it is worsening, um, or if anyone has got new confusion, just to report that to the right people. On the web page, so not on the apps, but on the web page, we do actually have a urinalysis records. I'll show you that as well, because you can just make a note there if you think someone might have a UTI, for example, and what action you've taken. As I say, it's not on the app, that it's on the web page. But I'll show you it. And we've also got a UTI assessment on the web page as well, which I can show you. Okay, so let me go on now to the demo site to see if there's any questions. No, okay. So we'll go on to some Q&As in a bit, but I just want to show you a couple of things on here. I'll just in light of those UTI charts I've just told you about on the web page, if I just show you what I mean by that. So if you suspect someone has a UTI, for example, which, as we know, in older people can cause confusion quite quickly. But if we suspect someone has a UTI, we'd want to send off a sample. So we'd perhaps record that in our home visit that we've done that, or we'd record that in our daily notes in the care home environment that we've done that. If you are in the care home, you can do it on the home care as well, but it would be those that have access to the web page. But what you can do is, I'll just put one in here for Sally and her assessments. I've put suspected UTI. So this is just a document that you can fill in. Obviously, as long as you've recorded that you've perhaps, sent off a urine sample, for example. But this is for those with a suspected UTI. So there might be symptoms that suggest that it's not a UTI. You might think it is, but it's not. These are those symptoms. If this person has got any of these, click which ones they've got. It's unlikely to be a UTI if they do have any of those. Call for a GP. Call GP for management if you've got any of those symptoms. If they haven't, keep that as a no. And then we've just got actions to take if they've got a catheter. If they've got any of these symptoms, we can click on them. So we need to consider a urine sample or a UTI if they have got any of those symptoms and send that off, or contact the GP at least. And if you don't have a catheter, it's the same. Pick the appropriate statements, get that urine sample sent off where possible, and inform your GP. Okay. So that's just a UTI assessment that you can have on there. And also we've got an observation chart in here. So again, you can't actually activate this to be on the app. It's just on the web page at the moment. And if we look at the urinalysis, we can record on here. So if your home care staff have, sort of messaged in to say if they've got a UTI, you could just record, why we think that is. So there's just a range of statements here that you can pick. Whatever there, and then just record what action you've taken. You can come back in here as well and then record what happened after the urine was sent. It might be prescribed antibiotics or whatever. For those services out there that do dipsticks, I know that's not every service, but for those that do, we do give you the ability to record that if you wanted to. So obviously only if you do dipsticks, but some of you might not, and that's absolutely fine. You can just do a description. But if you do dipsticks, you can record the results there. Okay, so there you go, you've got leukocytes and all those things. So if someone is positive for nitrites or leukocytes, that might indicate a UTI. There you go, you can record if you've got any traces of these elements in there. Okay, that's just your urinalysis chart. So I just want to, obviously we've got Sally's, I'll look at Sally because she's my demo person, but obviously I've got all my care plans here. I've written them all in a way that supports her with her confusion. Obviously we've gone into what supports in those slides, which will get sent out. So in all of the care plans, be mindful of that confusion, that long-term confusion. How are you going to support them? And that should be in all care plans. And then I just want to finish off this little section, just looking at that news chart. As I say, this isn't a full training session on news training. If you do want to use it, I'd rather you just message me if that's okay, so that I can give you proper training on it if you want to use it. So again, just message me at lucy@carebeans.co.uk. Um, Obviously, you can only use it if your staff are trained up in how to take observations. I'll look at the observations that we mean in a minute. But we can activate in the observation bit, we in the actions or the visits, we can activate the news chart. Let's just have a look at what I mean by that. So in the action section or the visits, depending on whether it's home care or care home, we can go into the observation section here and we can say yes to a news 2 chart. Okay, let's say yes to a news 2 chart. That little pop-up just said you need to get training if you want to use it. So we can say yes to the news 2 chart, and when we then go into the app, so I'm using the web page here, but it's the same sort of document that you see. So when we then go to use our news chart, there we go, it looks like this. So the news chart, just to remind you, is the National Early Warning Score. That's what it stands for. It's devised by the Royal College of Physicians. It's a standardized scoring system used in hospitals, community settings, etc. So we've obviously got permission to use that. So you do all your observations, it gives you a score, and then it gives you some guidance as to what to do with that score. But it can be a good indicator, early indicator for deterioration in health or sepsis. It gives you a score that you can then contact your GP or whomever and tell them the score. They will know what that score is. They will know what that score means. And it gives you the confidence to give them that information and, to insist a visit for that person. But if I just show you what that looks like, the news 2, so it's basically these observations. So it's resps per minute, respiration rate per minute. So let's say that was 16. We put it in there. Oxygen saturation. So let's say that was 99%. And then on room air rather than oxygen. They're not just breathing room air. You could put their blood pressure in. Let's actually give them some really high scores. So let's say their respirate is 40. That's obviously turned orange now. Anything that turns orange is like a high score. That alone tells us we need to contact the emergency services actually. Let's say they're on 94% or 95% on room air. That's gone slightly grey because that's sort of a bit concerning. Let's give them a very high beats per minute. And then it's this bit here. So when we're talking about confusion, which is obviously what we're focusing on today, we have these 5 sections and we pick one or the other. So whether that person is alert, whether they have confusion. So what we mean here is new confusion or worsening confusion. Okay, so it might be that the person has got dementia. They've been experiencing confusion for the past 2 years since they've been diagnosed. It's not worsening. So that in that case, they will just be alert if they're alert and can chat to you. But if it's new or if it's worsening, you can do confusion here. Or if they're only responding to voice, only responding to pain, or unresponsive. So you can click there that it's a new one. You see the very fact that I've clicked confusion, whether it's new, whether it's worsening, the very fact that I've clicked that has given it an amber, given that score an amber. So again, that on itself should prompt me to contact emergency services. And then let's give them a temperature. Let's say temperature's 38. Okay. So she's got very chaotic observations. And this is telling me that she's scoring a 9. So if I contact emergency services now, which she's telling me to do, I need to tell the senior for starters, and then I need to contact the medical team. This little eye here has got further details on what I should do, embellishes on this bit a bit more really. So I would need to contact someone immediately about that, emergency services, for example. We also get that on the operations dashboard. It comes through to there as well. But giving this score now, if I gave a score now to emergency services and said they've got a new score of 9, they would know what that meant. They would know that that was emergency response threshold. So that's just something you might want to consider starting to use. But as I say, if your staff are trained to do these, blood pressures and things like that. So do let me know if you want to have a session on that at all. Just drop me a line at lucy@carebeans.co.uk and I can go into that properly with all of your staff members. And that's it today on confusion. So does anyone, let's have a quick look in the chat. So if anyone's got any questions, feel free to ask. Or as I say, if you want to ask separately, you can always email me, lucy@carebeans.co.uk. That's absolutely fine. More than happy to respond individually. If you want that news training, also drop me a line because I can do that for you, no problem. And as I also say, next week, it'll be next week now. You'll get a link to whatever email was used to register for this. You'll get a link sent for your CPD certificate as long as you stayed for the full session. You'll get your link for the resource pack, and you'll get your link for or you'll get sent to you this presentation with all the slides and all that support in there. Oh, brilliant. Oh, that's good, Nicola. I didn't realise your background was dementia care, so that's good that you've enjoyed that. Glad you have. Thank you, Nicola. Emma, thank you. That's all right. You're very welcome. So Hannah, yeah, it should be available on our website. Just drop me a line, Hannah, lucy@carebeans.co.uk. You might still qualify for that CPD, for the CPD certificate. I can't remember what the cutoff is. Just message me, Hannah, lucy@carebeans.co.uk. And I can do something about that, just work it out for you. No problems, Annie. Glad you enjoyed it. That's all right, everyone. No problem, no problem. So thanks, Debbie. I don't think there's any questions then. So it looks like you're all sort of happy with that. So I'm pleased. Oh, thanks, Nicola. That's good, really nice of you. Thank you. All right, everyone. So I'm going to say farewell. I won't, actually, I'm not going to see you now till the new year. January, possibly February we'll start. It might be February we start again with the webinars, but have a look in the new year at the website and I need to just get some content put on there. But next month is my colleague Douglas. He's the clinical safety officer. He's doing GDPR. So do come and join us with that. I shall be joining that because I think that's quite an interesting one. Happy Christmas, Nicola. That's the first time someone said that to me yet. Happy Christmas to you too. Lovely. Goodbye, everyone. Thanks for attending, and I will see you very soon.